Any difficulty in study? Relax. Dental Anupam is here. Today we discussed about the most important joint, temporomandibular joint. What is the type of this joint? This is a complex bicondylar synovial joint. Articular surfaces. There is a two articular surface. One is superior articular surface, which is formed by the temporal bone. Temporal bone has some parts. One is tubercles of root of zygoma and anterior part of mandibular fossa, and non-articular part formed by tympanic plate. And inferior surface. Inferior articular surface is formed by the head of the mandible, and articular surface are covered with fibrocartilage. Why it is called fibrocartilage? Because it is made up of mainly collagen fiber and cartilage also. That's why it's called fibrocartilage. Now go to the ligament. Before I go to the ligament, we see in the pictures or diagram in articular surface of the right temporomandibular joint. The temporomandibular joints, there is a present of two compartment, upper compartment and lower compartment, and interarticular discs and head of the mandible. Now go to the ligament. In temporomandibular joint, mainly two ligament and total 4 ligament is present. First one is fibrous capsule. Fibrous capsule. It is attached above to the articular tubercle, the articular fossa, and the squamotympanic fissure, and below to the neck of the mandible. Lateral temporomandibular ligament. It is a true ligament and present between the articular tubercle on the root of the zygoma and below to the posterolateral aspect of the neck of the mandible. And sphenomandibular ligament is attached above to the spine of the sphenoid and below to the lingula of the mandible. It represents the unossified intermediate part of sheet of the Meckel's cartilage of the first pharyngeal arch, and it become medially to the medial pterygoid muscle. Stylomandibular ligament. Stylomandibular ligament is present between the styloid process of temporal bone and below to the angle of the mandible. Temporomandibular joint has an oval intra-articular disc. It's present between the two articular surface. The articular disc has a concave convex superior surface and concave inferior surface, and the periphery of the disc is attached to the fibrous capsule. Basically, articular disc has 5 parts. One is anterior extension, anterior band, intermediate thin zone, posterior band, and posterior extension. Anterior extension is connect or attachment to the tendon of lateral pterygoid muscle, and posterior extension is divided into or split into two parts, upper lamina and lower lamina. Upper lamina is attached to squamotympanic fissure and it's made up of fibroelastic tissue, and lower lamina is composed of fibrous non-elastic tissue, and it is attached to the back of the condyle of the mandible. Now go to the relations of temporomandibular joint. Uh, what is the lateral relation? In lateral, there is a presence of skin and fascia, parotid gland, temporal branch of facial nerve, and medial relation. In medial, there is a presence of tympanic plate separate the joint from the internal carotid artery, spine of sphenoid, and sphenomandibular ligament, and most important, auriculotemporal and cauda tympanic nerves, and medial meningeal artery. Anterior relation, uh, lateral pterygoid and mesenteric nerve and artery. Posterior relation, parotid gland separate the joint from external auditory meatus, and posterior there is a presence of superficial temporal vessel and auriculotemporal nerve. In superior, there is a presence of middle cranial fossa and middle meningeal vessels. And inferior relation, maxillary artery and vein. Blood supply of temporomandibular joint. There is a two main blood supply. One is branch from superficial temporal artery and maxillary artery. Nerve supply. There is a two main nerve, auriculotemporal nerve and mesenteric nerve. Movement. There is five main movement. One is depression, elevation, protrusion, retrusion, lateral or side to side movement. In temporomandibular joint, there is a two compartment. First one is upper menisco-temporal compartment and lower menisco-mandibular compartment. Upper compartment permit gliding movement and lower compartment permit gliding and rotational movement. Now go to the five movement and with help of muscle. Depression movement help with the lateral pterygoid, gravity sum, digastric, geniohyoid and mylohyoid muscle. Elevation. In elevation, help of three muscles: masseter, medial pterygoid and temporalis. Protrusion, medial pterygoid and lateral pterygoid. Retraction, posterior fiber of temporalis. And side to side movement, medial and lateral pterygoid muscles. Now go to the details of each movement. Depression. During depression, the head of the mandible along with an articular disc glide forward in the upper menisco-temporal compartment on both sides by contraction of lateral pterygoid muscle. At the same time, head rotate forward and underneath the articular disc by contraction of suprahyoid muscles, namely digastric, geniohyoid and mylohyoid. And gravity also help in opening of the mouth. Now go to the elevation. During elevation, the movement take place in reverse order to that of depression. That is, first the head of the mandible along with an articular disc glide backward in the upper menisco-temporal compartment by temporalis and masseter and medial pterygoid, and then head rotate backward on the lower surface of the disc by posterior fibers of temporalis. Now go to the protrusion. During this movement, mandible teeth moves forward in front of maxillary teeth. In this act, head of mandible along with articular discs gliding forward in the upper menisco-temporal compartment on the both sides by simultaneous action of medial and lateral pterygoid. Retraction. During this movement, head of mandible along with the articular discs gradle backward in the upper menisco-temporal compartment by contraction of the posterior fibrous of temporalis muscle and bring the joint in the resting position. Forceful retraction is assisted by deep fibers of masseter, digastric, and glenohumeral muscles. At the end of this movement, the head of the mandible comes to lie underneath the articular tubercle. Now go to the side to side movement. This movement occurs alternately in the right and left temporomandibular joint in chewing movement. In chewing movement, the head of the mandible on side glidles forward along with disc, but head of the mandible on the opposite side merely rotate on the vertical axis. As a result, chew movement forward and to one side, that is towards the side on which no gradle has taken place. Thank you.